We are here with Dr. Chen that has agreed to answer some of our questions. And we would like to start by asking you, after studying as a medical doctor, how did you learn about BNCT and when and how did you start working in BNCT?
Okay, thank you for your question. And why I start to learn BNCT is because in 2008, my hospital start to have a collaborative relationship with Tsinghua University. And my hospital, Taipei Veteran General Hospital, is a medical center in Taiwan. So we can have many new and modern cancer treatment facility. But BNCT is a very new and it's a targeted radiotherapy. It needs a lot of new concept and technique. So in 2010, I visited Kyoto University and to learn BNCT. And my mentor was Professor Ono. And he told me the mechanism and some technique of BNCT. And during the 2010, 1 year in Kyoto University Research Reactor Center, and I saw a lot of cases and a lot of patients who received the BNCT. So I know the power of the BNCT. So after I finished the learning from Kyoto University, I come back to my hospital and start to have the collaboration with the Tsinghua University Reactor Center. So we start to treat a lot of the patients, and this is the reason why I joined the BNCT group.
So in Taiwan, you have been able to treat many patients since you said that the center was created. And how was this experience for you?
Okay. I think it's a very precious experience because now all over the world, BNCT is still an experimental treatment, so not so much experience. So in my system, we start the clinical trial for recurrent head and neck cancer patients since the year 2010. And during that time, we can use the clinical trial for this kind of patient and found the treatment outcomes good. Even for that patient have a recurrence and they have no other aggressive treatment option. But we still can use the BNCT to help this kind of patients. And since 2017, we started to apply compassionate use for our recurrent brain tumor patients. And up to now, we already treat for more than 200 recurrent brain tumor patients. And the treatment outcome is amazing. So this is the reason why we will try our best to join and never give up this field, because we found that this is really a useful treatment and we can help a lot of hopeless brain tumor patients, and they can have a very good treatment, not only the treatment outcome, but also they can have a very good quality of life. So this is the reason why we will try to continue to help this group of patients by BNCT.
Let's say this is something that you already answered maybe, but which is the most interesting aspect of BNCT treatments in respect to other therapies that you can use?
Okay, because I'm a radiation oncologist, so we conventionally use photon to help the cancer patients. But as we all know, photon radiotherapy has a limitation. So sometimes we will see some radio-resistant tumor. This kind of tumor cannot be overcome by a conventional photon X-ray. But we found that BNCT is very, very powerful because it has a high radiobiological effectiveness. So we can use this kind of treatment to help to overcome the conventional radio-resistant tumor like melanoma, glioblastoma. And the response is so amazing, and I think it's very outstanding. So we believe BNCT is much different from conventional photon treatment.
Which is the future for Taiwanese BNCT?
Yes, because up to now, just like what I mentioned, now in Taiwan, BNCT is only an experimental treatment. And after our clinical trial and some treatment experience, we found that BNCT is a very useful treatment. So we hope in the future we want to promote BNCT as a standard cancer treatment, just like surgery, chemotherapy, target therapy, or immunotherapy. We hope BNCT can become standard treatment also. So now in Taiwan, the first step is we want to make education for our researchers. Then we can easily to spread the concept. Then maybe in Taiwan, we will also try to develop an accelerator-based BNCT system. Maybe we can import some reliable facility from other countries and to install this accelerator in the hospital. Then we try to negotiate with our government and make more clinical trial to let the BNCT become a very standard cancer treatment in the future. So this is our hope.
This is a nice hope to have.
Yes. Yes.
And speaking about hope and the future, what would you suggest to a young medical doctor that starts now in the field and wants to start working in BNCT?
Yeah. Just like what I mentioned, BNCT is an experimental treatment. And to speak frankly, BNCT up to now is not very, very mature. We still need a lot of new generation to join this field. So maybe we will try to invite more young generation and encourage them to make more research and study on BNCT field. I think it's very important that without this fundamental experiment, we cannot let BNCT become mature. So just like what we say previously, we want to make a very good education to young generation also, and let the BNCT become very common knowledge in Taiwan. And I think maybe in the future it will become very, very popular in Taiwan. Then more and more young doctors, they will have interest to join this field. Then we can spread the concept and the BNCT very easy.
Thank you.
Thank you. You're welcome.